Hi everyone, welcome to my theatre. In this movie, we will be learning about presbyopia. What exactly is presbyopia? Well, is this presbyopia where a cute little baby is holding the book very close to the face? No, this is not presbyopia. So what is presbyopia? Presbyopia is a condition where the person fails to appreciate the things which is very close to the face because of the shift in the near point. So basically, we have a near point where we see the things clearly, and when there is a shift in the near point because of which we can't see the objects which are very close to our face, we call it presbyopia. And this presbyopia, now you will ask, why does it happen? Like, why is it a disease? No, it is not a disease. It is just like graying of hair. The way our hair turns gray with age, in a similar way what happens is, with age, the lens has the ciliary muscles. So basically the ciliary muscles contract and relax, the capsule changes its shape, and the lens substance also changes its shape. The entire phenomenon is known as accommodation. So due to the accommodation, usually the image is focused on the retina, and when there is failure of the accommodation, the image is not focused on the retina. Basically, when the image is focused on the retina, we see. But when the image is not focused on the retina, instead it is focused behind the retina, we can't see. And this is what happens in presbyopia. Why? Because the entire lens system, the lens and the ciliary muscle, they have become weak. And because of which, the image is focused behind the retina. Now, when we try to understand the pathophysiology, there are three concepts. One is definitely the concept of accommodation, which I spoke about. That is the lens, ciliary muscle working together to change the shape of the lens. And there are two more concepts. And those concepts are, one is the near point of accommodation and one is the amplitude of accommodation. So basically the accommodation, the near point and the amplitude. So what is the near point of accommodation? Because this near point of accommodation has a lot to do with presbyopia. Usually, the near point of accommodation is the nearest point at which we see something clearly. And this near point of accommodation recedes with age, which means as we age, this near point goes far away from us. And how do we measure it? We can measure it with a RAF rule, that is the Royal Air Force rule, where this is the Royal, sorry, this is the Royal Air Force rule, where we place this on the nose and we move this in this bar, and when the person appreciates these things clearly, the nearest point at which the person sees blur is the near point of accommodation, and the nearest point where the patient sees things double is the near point of convergence. So this is how we know about the near point of accommodation and near point of convergence. Okay, so what is that instrument? That is a RAF rule, which is a Royal Air Force rule. And we see first a blur and then a double. Okay, so this is the near point of accommodation and this is the near point of convergence. And this is how we appreciate that the person is, and this is how we appreciate the near point. There is another concept, and what is that another concept? That is the amplitude of accommodation. And what is this amplitude of accommodation? Amplitude of accommodation is 100 by near point of accommodation. Near point of accommodation. Amplitude of accommodation is 100 by near point. So for example, the near point of accommodation is 25, then amplitude of accommodation in centimeter, it has to be in centimeter. Then the amplitude of accommodation is 4 diameter. Okay. So the amplitude of accommodation is 100 by near point of accommodation. So which can be, if the near point is 10, then the amplitude of accommodation is 100. And as I said, as we age, the near point of accommodation goes away, which means this value increases. And since this value increases, the amplitude goes down. As we age, the near point increases, the amplitude goes down. We can calculate this way, but otherwise we also have a table which we can fix in the OPD to know what can be the approximate amplitude of accommodation at a particular age and what can be the approximate near point of accommodation at a particular age. This will make our life easy. Now, these are the two concepts that are involved. Now, how will the patient present to us? The patient will not present to us because the patient will keep taking the newspaper away till the point where the patient cannot stretch his or her neck, and that is the point when the patient will present to us. Okay, that is the point when the patient realizes that no, I have to visit the doctor, and then he or she comes and says that I am having difficulty in seeing the distant vision, and you can see that the lady is holding the newspaper away from her and simultaneously is also squeezing her eyes trying to accommodate. Okay, and those will be the symptoms. What are the symptoms? It is difficulty to look at the near, difficulty in near work, and the second one is asthenopia. What is asthenopia? Strain in the eyes to look the near. Okay, these are the two common complaints with which the patient present to us. And as I said, this is not the condition. The little baby is enjoying the book very close to the face, and that doesn't happen in presbyopia. The patient cannot appreciate things very close to the face. And how do we treat? Well, before treating, we need to know some principles that are involved in the treatment of presbyopia. What are those principles? Principle number 1. First, we need to correct for the distant. First, we need to check the distant vision of the patient, and we have to ensure that the distant vision is okay, and then only we will come to the near vision. That is rule number 1. Second, the rule number 2 is each eye is corrected individually. First, we will check the right eye, close the left eye, and then we will check the left eye by closing the right eye. One eye, one after the other, we check. Third, it is always undercorrected. What is undercorrection? For example, a person needs a certain power. We usually give the power which is less than that so that the person is not affected. So this is the rule number 3. And rule number 4 is we usually give convex glasses. Why? Because the lens has to be convex so that the image is focused in the retina. And now since the lens is not able to be convex, we usually give a convex glass so that finally the image is focused in the retina. Okay, so with these rules, we prescribe glasses to the patient, which can be again it is a patient choice. Some patient will say that I need one glass for my distant vision, one glass for my near vision. So be it. Let them do that. Let them take. It's their choice. If a person says that I need a bifocal, what is a bifocal? Bifocal means the glass where the upper part helps us to see the distant and the lower part helps us to see the near. If the person says that I need a bifocal, we can give them a bifocal. So this is how the bifocal has. Like the upper part will help us in distant and the lower part will help us in near. If the person says that I need a progressive, and basically the progressive is very popular among the young people, the computer professionals. Why? Because in progressive we have the upper part for distant, the middle part for intermediate and the lower part for near. So the progressive helps us to see distant, intermediate and near. And if the patient opts for that, we give them progressive. Okay. So as I said, there are 3 options. One is, in fact, there are many options beyond 3. We have surgeries, we have refractive surgeries, we have lens exchange, we have so many stuff. But the important things for us to know is this 3. One is separate distant and near. The second one is bifocal. And the third one is progressive. Okay. So these are the 3. And this presbyopia usually comes around the age of 40. But there is no strict age. It can happen even before that. It can happen even after that. But usually somewhere around 40 there is onset of presbyopia. In myopes the onset is late. In hyperopes the onset is usually early. But somewhere around 40 the presbyopia comes. And there is a gross value, the gross calculation, and people say that if the person is between 40 to 44, you can give some somewhere around 145 to 50, around 1.5, 50 to 55, around 2, more than 55, around 2.5. But these values are very approximate, and each and every patient has to be individually checked. And if in every case we need to ask what kind of work they do, what is their routine working distance, what range of distance they want to see. So after checking everything, we usually prescribe them the final glasses. Yeah, otherwise before that we don't prescribe them glasses, and based on these tables we don't prescribe them glasses. We prescribe them glasses depending upon the kind of work they do, the kind of work they need to do, and the need and their routine habit of seeing an object. Okay, this was briefly about presbyopia, and I hope you enjoyed, and I hope